The administration says will help save American lives by slashing the price of popular weight loss drugs like Wegovy and Ozempic, making them far more affordable and accessible to far more Americans. President Trump announced the price cuts today. He was surrounded by executives from pharmaceutical giants like Lilly and Novo Nordisk. The deals will cut the cost of some of their popular weight loss drugs to less than $150 for a month's supply. Right now, it's over $1,000. That slashes the cost to just 1/9 of what they cost today. The drugs have been difficult for many consumers to afford until now because most insurers don't cover these drugs. But this new deal will extend to Medicare and Medicaid coverage, along with Trump RX that's due to launch next year. Trump touted the move today, along with Dr. Mehmet Oz, his Medicare and Medicaid administrator.
For years, politicians have talked about making health care affordable, but my administration is actually doing it. Americans deserve the best health care in the world, and we're now getting the best health care at the lowest price.
Our estimate, based on the company numbers as well, is Americans will lose 135 billion pounds by the midterms. But I don't measure it in pounds. I measure it in saved lives.
Obesity has been linked to stroke, cancer, and more than 40 diseases. But the increased use of these weight loss drugs have markedly decreased the obesity rate in this country. It dropped to 37% of adults this year. That's down from a high of near 40% just 3 years ago. For more, we're joined by Dr. Mahsa Tehrani, a board-certified rheumatologist, and Will Soliman, former pharmaceutical executive and founder and CEO of the Accreditation Council for Medical Affairs. Welcome to both of you.
Thank you for having us.
Of course. Will, I will start with you. President Trump said this deal may cut the price of obesity drugs to as little as $150 a month. You heard me say it's $1,000 a month right now. This will be a pill form of the drug. Explain how significant this is for the average American.
This is huge because you got about 12% of the population in the United States now is on a GLP-1 agonist. And remember, in America, about 1 in 5 patients is on Medicare. So it's a big deal. I think the question that remains is, what is it going to mean for commercially covered patients, right? If you're a patient and you're through your employer, you're getting private insurance coverage, it's going to put more pressure on those payers to reduce the cost.
Doctor, many Americans can't afford Wegovy or Ozempic right now. Do you think this deal would change that? And moving forward, with a medical perspective, is it a good or a bad thing? Maybe both.
Yes, I think that hopefully this will increase accessibility. You know, every other week there's a new indication that comes out about how beneficial these drugs are for our patients, from decreasing heart attack risk and stroke. Recently, they're even looking at arthritis, which is what I treat. So multiple indications. The bottleneck here has been accessibility for patients. And I think hopefully with these lower prices, absolutely. But remember, these are medications. I always advise everyone, diet and exercise should always be first priority. We should not reflexively jump to a medication, but having this option available now will significantly improve the health of our nation.
Dr. Tehrani, let me stick with you for a moment. Health Secretary Robert Kennedy said that the American public will lose 125 million pounds by this time next year. Is that an exaggeration, or do you think that will come true by this time next year?
I have seen in my own practice very impressive, massive amounts of weight loss. Sometimes I can't recognize patients. So, I haven't done the calculation, but that sounds reasonable given the fact that we have 100 million people in the U.S. right now that meet the standard criteria for obesity. So hopefully with those pounds lost, we will see an increase in overall health.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.